understand, you are going to come and practice here. You need to understand how their system works. So you need to understand a bit of their culture and how to communicate in their culture. What is we, what is poo, and how to use those small words, because you will get panicked if they would say what is doctor, if you use any medical terminology. So you should practice on that, and you should get a better like a guidance who gone through that and who know that, and just a bit of guidance, that is very important. But those 8 minutes are very important. How to improve your consultation structure? You just start practicing from the day you got to know about PLAB to Google whatever you find, search everything, get yourself a good mentor. I'm not promoting any of the academy, okay? You do need practice in UK, I understand. So, but if you think that something is very expensive for you, get maybe a small thing, okay? Get some practical sessions when come over here. Go bit by bit, understand, enjoy your journey. For me, for PLAB 2 was the only exam I enjoyed a lot. So if
Yeah.
you enjoy it, if you enjoy
Yeah,
it,
Dr. Zeeshan, I would really like to take this point and put an emphasis on this. Enjoy this, because for most of us, this is the first time we are going out of our country to take
yeah,
an exam. And honestly, on the exam day, I was more focused on what I would do after the exam. I had
yeah,
a list that I would
good
go
one.
around. There was a pizza shop. I would go around that and
Yeah,
I
there was a
would eat
beautiful
that pizza.
vibe, the scare.
Yeah,
That's a
it's a
beautiful
very
place.
beautiful place. I was so impressed because from our country, the kind of exams and the exam centers that we had been taking our exams in, even the board exams, they're nowhere near the exam center that we did our exam in, like here in the
Yeah,
Manchester.
I
So
believe
it was so
100% agree.
beautiful and I took my time to enjoy that.
That
So
square
yeah,
area, the big buildings, the coffee
yeah,
shops, the amazing vibe that give you.
yeah, so
And still, I
beautiful.
remember my exam day, and I'll recommend everyone whose exam is nearby.
Hmm.
When you enter into that 16 station cubicle, tell yourself this is your day,
Yeah,
and you're gonna tell the British doctor that you got some skills. They're gonna
yeah.
see a good doctor today. So you've been through this many
Mm.
times. You survived 6 years and you pass your PLAB 1. Congratulations. So you're just nearby to your goals to be a colleague soon, and just focus on the positives. So I agree with Dr. Noor. What if I fail? A lot of people do think, everyone do think. The
I think
people,
on that day you shouldn't be focusing on what if should I fail, or what would happen if I fail. You
uh,
shouldn't be focused on the results on that
I
day. You should
answered
be more
that
focused,
question.
yeah,
I answered that
uh,
questions.
on your
Noor,
performance. Yeah.
exactly. I answered that question that if you are going to fail first time,
Mm.
uh, is that you are a medical doctor, you've been failed many times already, so don't worry about failure. So there is something which is that going to improve you, so that positivity going to make you pass this exam. The pressure, stress is a real thing, but tell yourself that you are human and you have the miracles to do anything, and you done that. You studied from IMG market where the competition ratio is very high, and you're coming over here. You spent a lot of time to getting this dream come true, and you will be going to have this dream come true. So don't worry about that. Few more things, Noor, we have to discuss about what type of cases we're
Yeah.
gonna see. So a bit of very important, I would like to tell you, just on your first day, if you are going to start your PLAB 2 preparation, uh, the few scenarios, those are must scenarios you will see in your exam. SIMMEN is a must scenario. Prescription is a must scenario. So start doing those, start understanding those. And then there are clinical history scenario. The clinical history scenario would include from head to toe scenarios like CNS, CVS, respiratory, GIT, or the clinical history might include STI, UTI,
Mm.
male health, female health. So these are the history scenario, and the
Yeah.
child health, you will see the child health scenario as
Yeah,
well.
the pediatrics, the dermatology,
Pediatric.
all
So you
from
will see
system.
dermatology, rash, and everything. This is just, I would say it is less than half of your exam.
Mm.
Okay, then prescription, sometime there is one or two prescription you can have in your exam. Simmen, one is must, but sometimes Simmen is not present as well, but it is must. Ethical scenarios, LGBT. So this is a new thing for you, because in most of the country you might not have heard about lesbian, gays, bisexuals. So they want to assess you that how you're going to deal with them, with special groups. Abuse scenarios, someone having abuse like child abuse, old age abuse, pregnant woman being hit by partner, gay being hit by partner, and relationship with that,
The violence scenarios, yeah.
violence, colleague having relationship, colleague drinking alcohol and like drugs and everything, coming late, all those things, going to make you all rounder doctor. After your lab 2, I'm telling you, you will change, you will see a very like significant substantial change in your personality as a clinician. So this exam is very, like, you're going to pay £1,000 for that, and this preparation exam will be totally different and will change you as a clinician as well, I'm telling you. So I would say you should be a good doctor and human as well to pass this exam. If you are not, at least try to be a good actor to be a good human or doctor. Otherwise you're not going to pass it, because you have to improve yourself. So counseling, smoking, alcohol, drugs, medicine counseling, medicine side effect, teaching. They want you to be a teacher as well. So how to get 12 out of 12, how to do the basic life teaching. So these teaching scenarios, definitely, if you are good at teaching, if you have read, I don't know about that part, the only person who learned the most in the class is teacher himself.
Yeah.
So the thing is, if you start teaching your colleagues, that will help you to pass that scenario as well, and will help you to build up your lab 2 skills. Okay. Anything else, Noor, would you like to tell about the teaching things?
Yeah, so I think when you are, especially because most of the doctors, they do struggle with the examination part, examination of the mannequins. So I would really recommend that you watch the videos and you then go to academy or wherever you are and you
For
start
that,
teaching other
I
colleagues.
would say
Yeah.
UKPass, Simman. I would recommend UKPass. Me myself, I'm a trainer for the ALS
Yeah.
provider, and I love teaching these part. So I do assessment.
Yeah, for the
UKPass
live, yeah,
Academy.
for the live sim, and you can definitely because I do offer some discount with Dr. Zeeshan's
It's
hand.
all about, we are
Yeah,
going to help you.
so go to the academy, do the simman. I also have an online video on simman. It's just a 2 hour, and I
Perfect,
cover
perfect.
everything on simman in 2 hour online lecture. So you can watch that lecture and then go to the academy and perform the simman, because simman is important. You need reflexes for simman. This is something that is not going to come with just watching some online YouTube videos. It is something that you will get with practicing, and for that you need to go to the academy and practice on make your reflexes. Even if you're not like have a lot of days to practice simman in the academy, practice at home, but practice your simman.
Okay, last thing now. Thank you very much. Last thing is types of consultations in PLAB to Noor. Let's uh, talk about the types of consultations. So we're gonna see one telephonic. So doctor should practice how to do
Telephone.
customer services. So how to speak
Yeah.
without picture, video. So
Mm.
telephonic.
Yeah.